Hello, this is the first podcast that we're doing after a WAIMH EC meeting, and I'm the Executive Director Kaija Puura from the organization, and my guests today are Dr. Astrid Berg from Cape Town, South Africa, a board member and EC member, and Dr. Miri Keren from Israel, who is also our board and EC member and our past president. And we had a seminar on Wednesday with these two lovely ladies giving lectures, and now we're going to talk a bit about the topic. So Astrid, you were talking about trauma, psychological trauma and treatment. And what would you say, is it possible to help these people with psychotherapy?
Yes, I think Freud started in the beginning of the 20th century with the talking cure. And for a long time it's been sort of regarded as rather dubious that it would help, but now we have neuroscience actually showing us that talking and working through, and by that I mean integrating emotions with thought processes, actually changes the epigenetics of persons, so that through talking we can work through our own traumas, but also thereby prevent the transmission of the trauma to the next generation.
Well, isn't that wonderful? Mm-hmm. It gives us so much hope when we're doing this work. Thank you so much. And Dr. Keren, Miri, you were talking about infancy or infant mental health, and why do you think infant mental health is relevant for child and adolescent psychiatrists, or is it?
Well, maybe simply because mental health starts in infancy and continues into childhood and adolescent, and basically the basic skills that could define mental health, which is to be able to manage emotions, to be able to create close relationship, to be able to explore and learn, are relevant since, starting from infancy, and continue to be relevant to what we call mental health during school age and then during adolescence. And the second big reason is that non-verbal processes that take place during the interactions between the infant and the parent, usually, or the caregiver, are of a similar nature when we look at the quality of communication between peers, between adolescents, between the adolescent and the parent, and also between the therapist and the patient, whatever age he is. So I would say that there is continuity in the way of communication, of communicating, and in the very definition of good mental health or functioning. So that, I think, would be a summary.
Wonderful. So all of you who are working with infants and their families, remember that this work is important and we can make a difference. Thank you so much.